So hello, my name's Dr. John Johnson.
That's how John Johnson introduced himself a month ago, ahead of an interview about his clinic's cleaning and sterilization protocols, which public health officials were investigating. In that story, we showed this signage from his Stratford clinic, which says Dr. John Johnson, DP. Now, after it aired, we got a tip alleging Johnson is no doctor of podiatry and has no formal credentials at all. Then his stepmother, Melanie Johnson, came forward alleging the same thing.
I just want people to know what's going on there and to be safe. Would you ever let a person cut into your foot if you didn't think he was certified and educated?
Now, John's father, Brian, is a licensed podiatrist in New Brunswick and used to run Johnson Podiatry here on P.E.I. Melanie Johnson says John worked under his dad for a while and a couple years ago got to work on his own treating patients' foot conditions. The clinic website, which is now down, said he treated warts, bunions, corns, and calluses and used laser therapy. Melanie claims the 26-year-old's done all that without ever completing an actual podiatry program. She laid out her allegations in a Google review of his clinic in January. Shortly after separating from Brian, the clinic responded, saying, quote, Dr. John Johnson attended Salford University in the UK and graduated with a doctorate in podiatry. Practicing with no formal education or doctorate would be highly illegal and obviously cannot happen. Now, we reached out to Salford University. It says there's no record of Johnson ever registering there. We asked Johnson for proof of his credentials. He didn't provide them.
Accountability is important.
Howard Green, the head of the Canadian Podiatric Medical Association, says this speaks to the need for podiatry to be regulated on P.E.I. Most provinces do regulate it and require specific credentials for licensing.
If there were regulations in place, this wouldn't or shouldn't happen. But without the regulations in place, unfortunately, it's a bit of a free-for-all.
There's first of all a criminal aspect.
Though even without provincial regulations, this Toronto law professor says it may be illegal for someone providing medical services to claim to have credentials that they don't.
But if you utilize it, that credential, in order to either obtain fees, remuneration, or to touch people, invade their bodily space, then that's certainly not acceptable and runs into criminal and civil problems.
Now, Johnson's stepmom says she reported his alleged lack of credentials to a national health insurance group. That group told CBC insurance providers do require podiatrists to have formal credentials. And CBC has confirmed that Johnson is registered with some major providers and can bill them for his services. And one of those providers, Medavie Blue Cross, told us it puts its trust in the P.E.I. Podiatry Association to confirm the credentials of its members. According to a certificate on the wall at his clinic, John Johnson is a full practicing member of that association. His dad, Brian, is the president. Howard Green thinks there's a need for more due diligence.
Typically, yes, you would go to an association, but again, with one that's so small, it would be very, very simple for the insurance company to specifically check into that individual's claim credentials.
Now, neither the police nor provincial health or justice officials would say whether they are investigating John Johnson and his credentials. Johnson himself didn't respond to CBC at all for this story. His dad, Brian, didn't either. The P.E.I. government says it does plan to regulate podiatry this fall. Steve Bruce, CBC News, Stratford.
More for you now on our lead story tonight. P.E.I. podiatrist John Johnson is facing allegations he does not have the credentials he says he has. A sign at his clinic says Dr. John Johnson, DP. His stepmom says he has no formal training. CBC asked Johnson to show us proof of his credentials, but he has not. Steve Bruce has been working on this story, and he joins me tonight in studio with more details. So, Steve, if it's alleged John Johnson does not have any formal credentials, he's been calling himself a doctor. How has he been getting away with that?
Yeah, the Canadian Podiatric Medical Association says it really comes down to the fact that P.E.I. doesn't have any podiatry regulations, as most of the country does. And that means here on P.E.I., there are no rules around who gets to be a podiatrist. There's no regulatory body that licenses them and screens for credentials. So technically, the head of the CPMA says anyone could call themselves a podiatrist here on P.E.I. But as a law professor said to me for this story, that doesn't mean that anyone can go around and say they have a doctor of podiatric medicine or claim to have credentials that they don't, especially if they're using that to, to get money from people, to run a business, or to get patients to put their trust in them. The issue here, though, is that really, until recently, no one's called John Johnson's credentials into question. And you walk into his clinic and you certainly get the sense from what you see up on the wall that he is qualified. As you mentioned on the door, there's Dr. John Johnson, DP. There's also this signed certificate that's positioned on the wall, signed by the head of the P.E.I. Podiatry Association, and it says that John Johnson is a full practicing member of the P.E.I. Podiatry Association, and he has been since he was 21 years old in 2019.
So there is no regulatory body, but there is this P.E.I. association, the provincial association. So what is that?
You know what, we don't really know exactly what it is or what it does. What we do know is that John Johnson's dad, Brian Johnson, he's the president of the P.E.I. Podiatry Association. We know from the certificate that John Johnson is a member, but the association has a website. It's currently down, but when it was up, it did have the membership criteria laid out there. So to be a member of the P.E.I. Podiatry Association, you're required to complete a nationally recognized podiatry program and to complete New Brunswick's licensing exam. But I reached out to New Brunswick's Podiatry Association. They say John Johnson has never been licensed in New Brunswick. He's never written that exam. So we reached out to his dad, Brian Johnson, the president of the association, to find out how is it that your son John is a member. Given that, we didn't hear back from him. But the one thing that we do know, Louise, is that insurance companies tell us that they do require podiatrists to have formal credentials, and many of them rely on provincial associations to ensure that their members do have the credentials. So they're not going directly to the members to say, show us your diploma. They're putting the trust in the provincial associations that, okay, so-and-so is a member. That means that he does have a certification, that he does have the credentials. And we know that John Johnson is registered with many health insurance companies. He is billing for his services.
We know P.E.I. Chief Public Health Office investigated the clinic, John Johnson's clinic, for not properly cleaning and sterilizing equipment. So now that this has sort of come to light, are they investigating his credentials or anything else to do with his practice?
Well, we do know that John's stepmother, Melanie Johnson, she says she wrote to the health department back in February expressing her concerns, shared her allegations that John doesn't have any formal credentials and is working as a podiatrist here. She says she didn't really hear back from the department. I reached out to the department myself and said, are you investigating John Johnson? What I got back was an email from a spokesperson for both the health and the justice departments in this case. Now, that spokesperson didn't confirm whether or not they're investigating John Johnson. What that email did include was a reference to two sections of P.E.I.'s Regulated Health Professions Act. Now, the one section that was highlighted says that if you are unregulated, as podiatrists are, you're limited in what you can do here. You're not allowed to perform procedures under the skin, not allowed to diagnose diseases and disorders. You're not allowed to prescribe drugs or apply energy in any form. And then the other section says that you can't use titles and abbreviations that imply that you are part of a regulated health profession. But Louise, I asked in a follow-up email, what do you mean by that? What are these titles and abbreviations that are off limits if you're unregulated? Didn't get anything back. No specifics on why she shared those two sections of this act, or whether they specifically were investigating John Johnson for violations of these sections.
Right. How does that apply? Okay. Has John Johnson said anything about this?
Well, last week I reached out to him by email. I also hand-delivered a letter to his clinic laying out all the allegations against him to give him a chance to respond. And I said in that email and the letter, can you show us proof of your credentials? But I didn't hear back at all from John.
What happens now then?
Well, Louise, we know that the P.E.I. government plans to regulate podiatry this fall. We don't know what that means for Johnson Podiatry and for John Johnson. I called the clinic today to see if they're open. Nobody answered. Last week when I dropped off that letter, the receptionist said it was open, but that John was off for the week. And when I was there was a couple that was sitting out in the parking lot. And they'd driven all the way down from West Prince. The man had an appointment with John Johnson. Got chatting with them. I didn't say to them, though, what story I was working on or the allegations that we'd heard about John Johnson. But I did ask them, why is it that you chose John Johnson to have your foot looked at? And he said, well, he's got doctor in front of his name. So, you know, we don't know if John Johnson has earned that title at this point, but I think it's safe to say when you hear that, it just goes to show how much weight that title really carries.
Absolutely. Steve Bruce, thank you so much for all your hard work on this.
You bet.